Today evening to participate in this function to inaugurate the VICTUS Femtosecond laser treatment for cataract at Maxivision, Hyderabad. My greetings to the Maxivision founders, chairman, doctors, eye care specialists, nurses, paramedical staff and technicians of Maxivision Eye Hospital and the other distinguished guests participating in this function. I have already visited Maxivision Hospital earlier and seen the latest facility. When I was addressing Children's Science Congress at Bhubaneswar on 5th January 2012, I was answering a question from a student about space-time. He was talking about space-time. While defining the femtosecond, I explained to the student that common man will slice the time to maximum 1/100th of a second, whereas scientists in the field will slice the time into femtosecond, which is 10 to the power of minus 15 seconds, which may decide a fast photochemical reaction. That is the time takes fast photochemical reactions. At that time, I did not realize there is an exclusive femtosecond laser treatment available for removal of the cataract. Now I can link the femtosecond laser application in ophthalmology in addition to the supercomputers of the future. The introduction of the femtosecond laser cataract surgical treatment by the Maxivision will help and redefine the cataract surgery and its benefit in the future. Cataract surgery has changed to a very refractively oriented type of procedure with the intervention of femtosecond laser, with patients expecting a good outcome with minimal reliance on spectacles and other visual aids. They want to see a better without glass than they ever have. This gives us a chance by being able to define these very important parts of the procedure, even a cataract incision, to make it much more predictable with the potentiality of better outcome. Femtosecond laser in the refractive cataract surgery arena is probably an important topic at the moment in the field of ophthalmology. The technology that allowed refractive surgery to grow and expand and become more precise for better outcomes is now spilling over into other areas. It is spreading over into the area of cataract surgery and generating a lot of attention because of implications about the size and scope of it and what it might potentially deliver in terms of the improved outcome from a refractive perspective. Further, it has to be established by carrying out thousands of surgeries using femtosecond laser surgeries. Now, when the benefits of femtosecond laser treatment seems to be a predictable outcome and safe procedure, in 1968, an Indian scientist, a PhD physics of IIT Kharagpur, and hailing from West Bengal rural culture of a mud house, was invited to join the team at the Research and Technology Center of Northrop Corporation, USA, a major aerospace contractor who offered extraordinary facilities for a working physicist, Indian scientist. He was passionately working in the area of carbon monoxide laser. Based on his research, his colleagues at Northrop demonstrated the most powerful continuous laser to date, 1968. In a further step forward, the Indian scientist was able to make the laser operate at a room temperature, something previously thought of impossible. The Indian scientist presented his result to University of California, Los Angeles seminar. Edward Teller, the man whose revelatory insight had earned him the title Father of the H-bomb, was there. Dr. Teller was so intrigued and intrigued by the presentation of the Indian scientist and appreciated. The Indian scientist says that he could validate himself as a scientist only when Soviet scientists later wrote in a prestigious Russian journal, after Gomik's thorough work on the carbon CO laser, there is not much left to do on that laser. This brought international recognition to this scientist coming from a rural background. Do you know who is that scientist about whom I am talking? Of course, it is Dr. Manilal Bhaumik, who has authored a book titled Code Named God Integrating Science and Spirituality. I am sure you will be keen to read more about this laser scientist, Dr. Bhaumik. His invention, the laser, has led to the development of a LASIK, an important application of eye surgery so far we are all using. Now, dear friends, diagnosing diseases accurately without inducing diagnostic pain indeed reflects the professional excellence of the healthcare giver. Curing the patient with precise treatment, with minimum time and cost and zero side effect is a tribute to the human ingenuity. Of course, based on the diagnosing the disease and the curing experience, the healthcare giver becomes a teacher to the families and other patients. The preventive cure is indeed a great contribution. There are two fields in medicine, curing and preventive. I am sure both area is known to all eye surgery, eye people. Now, multi-application of a femtosecond. I was thinking, when I saw that femtosecond laser system in Maxivision, I was asking myself, what does it mean? My expert friend says that femtosecond laser technology can be used for sectioning of cornea with a higher level of precision and accuracy. This is another application. This will also enable avoidance of an area of cornea usually responsible for rejection after keratoplasty surgery. Femtosecond laser thereby in turn will allow the cornea to remain transparent for a longer period of time, namely 5 to 15 years. By increasing the longevity, the patient will not require another surgery, thus avoiding higher cost to the patient and in turn improve the overall economics of healthcare. Similarly, the same laser technology can also be used for retina stem cell therapy. I am telling the multiple application of the laser, femto laser, what now is added in Maxivision. I would suggest Maxivision to form a task team of experts to explore the possibility of multi-dimensional application of femtosecond laser to make it cost effective to the patient. In conclusion, I will say that we have the best of doctors and the technologies in India. We have core competencies in design and software engineering. Emerging technologies in virtual reality and micro machine will transform the healthcare scenario. This transformation should lead to helping the people who cannot afford the modern medical care with the research and development as focus. My best wishes to all of you in Maxivision for success in your mission of removing pain of the needy patient. My hearty congratulations for Maxivision for adding a femtosecond equipment, a system for giving the good accuracy in cataract operation and another multiple application. Thank you. God bless you.